Hello everyone. Nowadays, when I meet a couple, when they're planning for a pregnancy, most of the time when I ask them about their sexual frequency, most of them just mention, Doctor, we try to be available for each other between day 10 to day 14 or day 12 to day 16. In the mari or random dates everybody gives me. I think whenever you're planning for a pregnancy, frequent sexual intercourse is very important rather than focusing on ovulation. I will try to break this myth why I'm saying it's not right, because women, we don't understand, we cannot really predict exactly when we are ovulating. So women who have a regular cycle, that is every 28 days ku namal correct periods vandirudhu, every 30 days ku correct periods vandirudhu அப்படிங்கற பட்சத்துல தான் we can exactly calculate the date. That is, we expect you to ovulate somewhere between 14th day, 15th day or 16th day, and you can focus on that. Sometimes, very rarely, when you have a polycystic ovary, but then the symptoms are not that great, that is very mild symptoms. You might still get your periods every month regularly, but not necessarily that you should ovulate. So I have seen women who are coming for such kind of problem where we understand that this woman is getting periods every month, but then she's not ovulating only when we start following her through the entire 30 days, that is through a follicular tracking. So in the mari pandrappo da even we ourselves will be able to understand this woman is getting her periods regularly, but then she's not ovulating. This is a rare situation, it doesn't happen very frequently, but still this can happen. Spending a year or 2 years thinking that you're ovulating and focusing on 14 to 16 day of your every month to have an intercourse sometimes might not be the right thing to do. So another way, how do I identify what are the common symptoms which can tell me that I'm ovulating is sometimes you will have your cramp, pain, which can be identified by certain women that they can understand that they are ovulating. That is one very important thing. Second is your body temperature can slightly increase, that is increase by 1 degree centigrade. And third will be your vaginal discharge. Sometimes you will have a slightly thicker mucoid discharge, which will give you an identification that you might be in the ovulatory period. So these are very small things, but idha mattume vechittu we can't completely say that you're ovulating unless and until your cycles are very regular. Probably you can try having a focused timed intercourse, but my suggestion would be not to follow that, because you don't have a guarantee that you're ovulating at that particular time. How do I understand? There are certain women who are using apps to follow ovulation. So will this app tell you or guide you the right time? It is just give a predictive time. It is not going to exactly tell the time for every woman. So following an app, again, when you're planning for a pregnancy, is something which is not right. Probably ஒரு 3 months 4 months க்கு நீங்க app சொல்றத கேட்கலாம், or நீங்களா உங்களோட மைண்டை யூஸ் பண்ணி ட்ரை பண்ணலாம். But after 6 months, if that is not working, I think you should think back and change your pattern or have a consultation with your doctor to understand what is happening with your body. And women with PCOD, already நம்ம கல்யாணத்துக்கு முன்னாடியே polycystic ovary இருக்கு, you have a cycle which is 35 to 45 days or 50 to 60 days, or மாத்திரை போட்டால் தான் periods வருது, அந்த மாதிரி cyclesல இருக்கிறவங்க, I think it is better to come and meet their gynecologist early to understand whether the ovulation is happening, whether to understand whether when to have an intercourse, whether you need help to conceive. இதெல்லாம் நம்ம early-ஆவே தெரிஞ்சு வச்சுக்கிறது நல்லது. Other group of people is endometriosis. Endometriosis, again, you will have a very regular periods. So very regular periods la irpanga, but for them the dysmenorrhea, that is pain during the menses, will be very high, or sometimes they'll be painless also. So in the mari mild variety of endometriosis is a confusion. You will not have much symptoms outside and your periods will be very regular, but you will not be able to conceive due to other reasons. So even ovulation time அப்படின்னு நம்ம ஃபாலோ பண்ணுறதை காட்ட ஒரு 6 monthsல டாக்டரை வந்து பார்த்துட்டு having yourself tested to understand the level of endometriosis and then plan your pregnancy is something which you should think about. Other group is hypothyroid and other prolactin imbalances இருக்கிறவங்களுக்கும் again you might have an anovulatory cycle, that is egg development இல்லாம period sometimes கொஞ்சம் delayed-ஆ வரதுக்கான வாய்ப்பு இருக்கு. That is, they will not miss their periods, they will have a delayed periods, but then they will not have a egg production for that month. So these group of people who already have identified that they have a hormonal issue I think you people cannot just blindly follow timed intercourse. And anybody, even if you're having a regular periods and you don't have any hormonal imbalances, my only advice is if you're planning for a pregnancy, have a frequent intercourse. That is, every day it could be, or alternate days, or minimum once in 2 days. In a week, at least 3 to 4 days, if you have a frequent intercourse, I think it will cover your ovulation any point of time. எப்பயுமே மிஸ் பண்ணாம இருக்கிற மாதிரி இருக்கும். So that there is more chance for you to conceive. So timed intercourse is not for everyone.